How do you help somebody who's suffering with chronic pain and they also have several other coexisting problems? I'm Dr. Steve Grinstead, and I want to answer that question because I've been working with people who are suffering with chronic pain and coexisting disorders, including addiction, since 1984. And since 1996, it's been such an exciting journey. That's when I started developing my addiction-free pain management system. It's based on sound research principles and in part on the Gorski synapse relapse prevention model, and it has been an awesome journey putting that together. I've also written several books about this. One is Managing Pain and Coexisting Disorders, using the addiction-free pain management system, and also Freedom from Suffering, A Journey of Hope. The reason you're watching this video is because I want to invite you to come join me here in our beautiful space here in Sacramento, California on April 21st through 23rd for my last addiction-free pain management certification school in Sacramento. In the future, it's going to be in Southern California. This will be the last time in Northern California, so I really want you to take advantage of this. What is this training about? Well, past participants have said many things about it. So if you're watching this video, say on YouTube or on Facebook, go to the link below and read my Freedom from Suffering Now blog, because it will give you a lot more information about what this training comprises, and even 2 testimonials from former prior students who really got a lot out of this. Many of the participants, when they walk away, they think, wow, now I have a fighting chance. I feel more confident and competent in order to help people with chronic pain and coexisting problems, especially addiction. This will be a 3-day experiential journey. It's going to be a combination of me sharing the process, what it's about, the system and principles, then demonstrating how to implement each of the clinical core model components, and then you'll have a chance to practice it. So it's going to be a very hands-on experiential 3 days, 20 hours, and it'll go by so quick you won't even believe it's been 3 days. That's the feedback I get the most often on day 3. Don't hesitate. There's links all over here for you to go register now, and please, our space is limited here. I am going to limit because I don't want to be everybody crowded and everything. So, it's really important to register early so you can reserve your seat. I really want to support you in finding more tools on how to help people suffering with chronic pain who are also experiencing coexisting problems. We'll cover some of the most common co-occurring problems besides addiction, and that's depression, sleep disorders, anxiety disorders, trauma disorders, and even eating disorders, using food to cope instead of fuel once you start getting your pain managed. And that could lead to a pain rebound, and that can also lead to using medications inappropriately once more. There's a lot of tools that are going to be skill trained into you during this 3 days. You'll have an opportunity to work with other healthcare professionals from all across the United States. We always get a multidisciplinary audience. We'll get counselors, we'll get therapists, we'll get nurses, we'll get doctors. We have a lot of people coming that want to be able to help. The last couple of years, there's been a major outcry across the country. We have a prescription drug epidemic. We have a chronic pain epidemic. The numbers are staggering. Depending on which research you look at, there's between 80 million to, one report, the Institute of Medicine said 116 million people suffering with chronic pain in the United States. That's about 1 in 4 people. Even if it's at the 80 million or the 100 million mark, that's still a lot of people. And if we use a conservative estimate, about 10% of those people will be experiencing medication management problems or other coexisting problems. Depression is the #1 co-occurring disorder for people suffering with chronic pain. And we'll talk about what to do about it, how to develop a treatment plan that gets people out of the problem into the solution and helps them achieve that freedom from suffering. And I believe that freedom from suffering is everyone's right. And as you'll hear in the training, I believe it's also their responsibility. And I believe it's our responsibility as healthcare providers to give people the very best tools possible. So don't wait any longer. Stop the video and sign up now, and then come back and finish the video, because I really want to make sure that you have your space reserved. This will be an exciting opportunity. When you hear about, I'll be sharing some of the personal stories of patients I've worked with. Other participants will probably be willing to share their experiences. So how do you help people? That's what you're going to find out. How can you better serve people who are suffering with chronic pain? I really love doing this work. Teaching people how to help people is my primary mission statement, and I want you to come sign up and help me achieve my mission statement, please. This is going to be an awesome journey. And again, this will be the last time in this space, which I'm having mixed feelings about. I'm very excited about what's coming, but I'm very sad about, we've been here since 2010, and I've had a lot of people take my workshops and skill trainings here in this space. So, come join me before it's too late. I really want you to take this opportunity to have 20 hours that are focused. And I will have time, because we are limiting the numbers, I will have time to spend individual attention with people. I will be helping you see how this works in the real world with real people. So don't wait any longer, Sign up now and come see me in April. And there's more information on the registration page. And, it's an awesome opportunity for you to help people achieve that freedom from suffering. Thank you very much, and come back soon.